Welcome to my channel Health for You. 12 risk factors of infertility. In medicine, a risk factor is something that raises the risk of developing a condition, disease, or symptom. For example, obese people are more likely to develop diabetes type 2 compared to people of normal weight. Therefore, obesity is a risk factor for diabetes type 2. Age. A woman's fertility starts to drop after she is about 32 years old and continues doing so. A 50-year-old man is usually less fertile than a man in his 20s. Male fertility progressively drops after the age of 40. Smoking significantly increases your risk of infertility. Smoking in both man and woman increase the risk of infertility. Smoking may also undermine the effects of fertility treatment. Even when a woman gets pregnant, if she smokes, she has a greater risk of miscarriage. Alcohol consumption. A woman's pregnancy can be seriously affected by any amount of alcohol consumption. Alcohol abuse may lower male fertility. Moderate alcohol consumption has not been shown to lower fertility in most men, but is thought to lower fertility in men who already have a low sperm count. Being obese or overweight. In industrialized countries, overweight, obesity, and a sedentary lifestyle are often found to be the principal causes of female infertility. An overweight man has a higher risk of having abnormal sperm. Eating disorders. Women who become seriously underweight as a result of an eating disorder may have fertility problems. Being vegan. If you are a strict vegan, you must make sure your intake of iron, folic acid, zinc, and vitamin B12 are adequate. Otherwise, your fertility may become affected. Over-exercising. A woman who exercises for more than 7 hours each week may have ovulation problems. Not exercising. Leading a sedentary lifestyle is sometimes linked to lower fertility in both men and women. Sexually transmitted infections (STIs). Chlamydia can damage the fallopian tubes as well as making the man's scrotum become inflamed. Some other STIs may also cause infertility. Exposure to some chemicals. Some pesticides, herbicides, metals, lead, and solvents have been linked to fertility problems in both men and women. Mental stress. Studies indicate that female ovulation and sperm production may be affected by mental stress. If at least one partner is stressed, it is possible that the frequency of sexual intercourse is less, resulting in a lower chance of conception. Infertility problems in the uterus or fallopian tubes. The egg travels from the ovary to the uterus, where the fertile egg grows. If there is something wrong in the uterus or the fallopian tubes, the woman may not be able to conceive naturally. This may be due to surgery, Pelvic surgery can sometimes cause scarring or damage to the fallopian tubes. Cervical surgery can sometimes cause scarring or shortening of the cervix. The cervix is the neck of the uterus. Submucosal fibroids, benign or non-cancerous tumors found in the muscular wall of the uterus, occurring in 30% to 40% of women of childbearing age. They may interfere with implantation. They can also block the fallopian tube, preventing sperm from fertilizing the egg. Large submucosal uterine fibroids may make the uterus cavity bigger, increasing the distance the sperm has to travel. Endometriosis. Cells that are normally found within the lining of the uterus start growing elsewhere in the body. Previous sterilization treatment. If a woman chooses to have her fallopian tubes blocked, it is possible to reverse this process, but the chances of becoming fertile again are not high. However, an 8-year study shows tubal reversal surgery results in higher pregnancy and live birth rates and is less costly than IVF. Medications. Some drugs can affect the fertility of a woman. These include non-steroidal anti-inflammatory drugs. Women who take aspirin or ibuprofen long-term may find it harder to conceive. Chemotherapy. Some medications used in chemotherapy can result in ovarian failure. In some cases, the side effect of chemotherapy may be permanent. Radiotherapy. If radiation therapy was aimed near the woman's reproductive organs, there is a high risk of fertility problems. Illegal drugs. Some women who take marijuana or cocaine may have fertility problems. Ten causes of infertility in women. There are many possible causes of infertility. Unfortunately, in about 1/3 of cases, no cause is ever identified. Evolution disorders. Problems with evolution are the most common causes of infertility in women. Experts say evolution is the monthly release of an egg. In some cases, the woman never releases eggs, while in others, the woman does not release eggs during cum cycles. Evolution disorders can be due to premature ovarian failure. The woman's ovaries stop working before she is 40. Polycystic ovary syndrome. The woman's ovaries function abnormally. She also has abnormally high levels of androgen. About 5% to 10% of women of reproductive age are affected to some degree and also called Stein-Leventhal syndrome. Hyperprolactinemia. If prolactin levels are high and the woman is not pregnant or breastfeeding, it may affect evolution and fertility. Poor egg quality. Eggs that are damaged or develop genetic abnormalities cannot sustain a pregnancy. The older a woman is, the higher the risk. Overactive thyroid gland. Underactive thyroid gland. Some chronic conditions such as AIDS or cancer. Scientists discover gene that may explain infertility. Scientists from the University of Edinburgh reported in the Journal of Cell Science that they identified a gene that controls a vital process in the formation of healthy fertile eggs. They say their breakthrough will help researchers better understand how cells divide during reproduction. which in turn will help explain how fertility and sterility. What is infertility? Infertility refers to an inability to conceive after having regular unprotected sex. Infertility can also refer to the biological inability of an individual to contribute to conception, or to a female who cannot carry a pregnancy to full term. In many countries, infertility refers to a couple that has failed to conceive after 12 months of regular sexual intercourse without the use of contraception. Studies indicate that slightly over half of all cases of infertility are a result of female conditions, while the rest are caused by either sperm disorders or unidentified factors. According to Health for You, about 20% of cases of infertility are due to a problem in the man. About 40% to 50% of cases of infertility are due to a problem in the woman. About 30% to 40% of cases of infertility are due to problems in both the man and the woman. According to the Department of Health and Human Services, USA, approximately 10% to 15% of couples in the USA are infertile, meaning they have not conceived after at least 1 year of regular unprotected sex. Many cases of apparent infertility are treatable. Infertility may have a single cause in one of the partners, or it could be the result of a combination of factors. Use this video to learn what causes infertility. Also get an overview of risk factors and how infertility is diagnosed. We outline the treatment options available, including IVF and surgery, and the complications caused by infertility. Five causes of infertility in men. The following are common causes of infertility in men. Semen. Semen is the milky fluid that a man's penis releases during orgasm. Semen consists of fluid and sperm. The fluid comes from the prostate gland, seminal vesicle, and other sex glands. The sperm is produced in the testicles. During orgasm, a man ejaculates, releases semen through the penis. The seminal fluid helps transport the sperm during ejaculation. The seminal fluid has sugar in it. Sugar is an energy source of sperm. Abnormal semen is responsible for about 70% of all cases of male infertility. Unfortunately, in many cases, doctors never find out why the following semen problems are possible. Low sperm count, low concentration. The man ejaculates a lower number of sperm compared to other men. Sperm concentration should be 20 million sperm per milliliter of sperm. If the count is under 10 million, there is a low sperm concentration, subfertility. No sperm. When the man ejaculates, there is no sperm in the semen. Low sperm motility. The sperm cannot swim as well as it should. Abnormal sperm. Perhaps the sperm has an unusual shape, making it more difficult to move and fertilize an egg. Sperm must be the right shape and able to travel rapidly and accurately towards the egg. If the sperms morphology, structure, and mortality movement are wrong, it is less likely to be able to reach the egg and fertilize it. Chances of conceiving within 1 year. In Europe, North America, and much of the world, approximately 85% of couples will conceive within 1 year if they have regular unprotected sex. Averages in the UK are as follows: National Health Service. 20% will conceive within 1 month. 70% will conceive within 6 months. 85% will conceive within 12 months. 90% will conceive within 18 months. 95% will conceive within 24 months. Therefore, doctors in the UK will not usually diagnose a couple as infertile until 24 months have passed without conception and regular unprotected cell. Most people will see their GP, general practitioner, primary care physician if there is no pregnancy within 12 months. According to the National Health Service, UK, a couple that has been trying to conceive for over 3 years has a maximum 25% chance of conceiving over the subsequent 12 months if they continue trying.